we know there's been this larger movement to increase healthcare access, to improve quality. But underneath that movement has been a group of folks who have committed to really pushing the boundaries, making sure that we widen the safety net, stretch the umbrella a bit to include as many individuals as we surely can. A lot of people, when they hear me say, when they hear that I've written this book called 150 Years of Obamacare, they go immediately to, oh, 150 years? But that's not the case. We have been trying to push a health equity agenda for over 225 years. And no matter how hard these health equity champions tried to reinsert that language, to get it over the passage, to get it passed, they just couldn't succeed. And so, thankfully, President Abraham Lincoln's folks, although he died, he was assassinated a few weeks after that bill was signed into law, his folks decided, well, you know what, we believe we have the authority to establish hospitals, to increase access based on the language in that bill. So even though it wasn't explicitly included, they found a way to get around it. So after that, though, here's the clicker. So we didn't get mental health reform signed into law. We get this comprehensive health reform, this what I call the first social determinants of health law signed, but that only lasted 7 years.
Joining us now is Daniel Dawes. He is the author of The Political Determinants of Health. And Daniel, thanks for being with us. First of all, one of the things that I found interesting is that your book deals with the fact that these determinants not only affect our health, they affect our lifespan.
That's right, absolutely. So, you know, we've long been talking about inequities in this country, and many folks think that, you know, these racial disparities that we see today just suddenly appeared. And that's really not the truth. They have been with us for over 400 years. And yet, from the research, we've gotten closer to understanding what is driving these inequities in our society, right? And a lot of folks will talk about the social determinants. These are your structural conditions in which we're born, in which we live, we pray, we work, and they have about a 40% impact on our lifespans. So what I have done is to say, wait a second, underlying each of these social determinants of health. So these are your, whether you have safe and secure housing, do you have transportation to get to work or to get to your school or get healthcare services? Do you actually, are you able to access a grocery store that offers fresh fruits and vegetables? These are what we call the social determinants of health. But undergirding every single one of these social determinants is a political determinant of health. These are the main instigators impacting us. So when we look today at what is happening in America, when folks have seen now for the first time the magnification of health, right?
I think the phrase was renewal.
I'm sorry?
Yeah, the phrase was urban renewal.
Urban renewal, thank you, that's right. And so when you look back at what caused this urban renewal, it was a political determinant. And today we see higher rates of asthma, for instance, in Harlem, New York. And what research has shown is because of bus depots that were located there in Manhattan, 6 of the 7 bus depots in Manhattan were placed in the Black community. If you go again into many of these other communities, it was a highway act, a federal policy that created these types of infrastructure. The Urban Renewal Program with the Housing Act created the decimation of housing for hundreds of thousands of African Americans. And this was under, you know, Franklin Delano Roosevelt, under Harry Truman, as well as Republican policymakers throughout our decades.
Because those people didn't like Black folk, or did it happen because pretty much politics discriminates against poor people?
Well, what they will argue, we know that there have been facially discriminatory laws in this country, right, where they were intentionally designed to redline and to discriminate against communities of color. But as we moved into the early 90s, or actually in the mid 90s, you saw folks moving towards more facially neutral laws, right, that weren't intentionally discriminatory on their face, but had a discriminatory impact. So it's debatable on whether it's truly intentional. I would argue that that is the case. If you look at Social Security, for instance, the NAACP had railed against the intentional omission of African Americans in terms of domestic workers and agricultural workers, 90% of which would have pushed out the Black population from receiving benefits. So it's debatable, I think, in whether it's really intentional or it's just having a discriminatory impact. I actually lean on the side that there probably is more intentionality there than there is a discriminatory impact.
Daniel, we're going to take a break. When we come back, I want to talk about how do we go forward? What do we do to fix this problem? Because it is an interesting dynamic in a lot of neighborhoods, jobs versus poor health. So stay with us.
That's right.